Hello, today we'll be seeing about anal triangle, which is part of perineum. So if you see the perineum how in lithotomy position, anteriorly this is the pubic symphysis, ischiopubic ramus, and this is the ischial tuberosity, and behind there is coccyx, and joining this coccyx to this ischial tuberosity we are having sacrotuberous ligament. And if you are drawing an imaginary line joining this two ischial tuberosity, that triangle that will be dividing this perineum into two halves. Anterior part is urogenital triangle, the posterior part is anal triangle. So we'll be seeing this anal triangle. So in this, what are the parts? This imaginary line between the two ischial tuberosities will be dividing the perineum into anterior urogenital triangle and the posterior anal triangle. In the anal triangle, what are the parts? We'll be seeing anal canal with external anal sphincter and all, anteriorly perineal body, and on either side of the anal canal there is a space called, that space is between the ischium and the anal, that it is called Ischioanal Fossa, which was previously called Ischiorectal Fossa. So anal canal will be seeing in further classes, but now we'll be seeing about the Ischioanal Fossa. So this Ischioanal Fossa you can see under different headings like. So today the subtopic is Ischioanal Fossa. Where it is located? This is located on either side of the anal canal, and it's present between the anal canal and the ischial tuberosity. So how many are there? There will be two, one on the right side of the anal canal, one is on the left side of the anal canal. In this, that is location, then we'll be seeing what are the boundaries of it, then what are the fascia related with that contents, and applied aspect. So if you see the previous diagram, how was it? Anteriorly pubic symphysis, this will be ischiopubic ramus, laterally and ischial tuberosity, posteriorly coccyx, and this is sacrotuberous ligament. So it's between the sacrum and the ischial tuberosity, and this is the imaginary line dividing the perineum into two triangles, perineal body, and this is anal canal. So we are concerned with this part. So this is Ischioanal Fossa. So one is on the right, one will be on the left side. So two ischioanal fossa, and additional to that, this ischioanal fossa will be having some extensions anterior, that is anterior recess, some extensions on either side of the coccyx, that is posterior recess. And in other diagram we can see further how this ischioanal fossa is there. We'll be seeing half of the diagram. So this is, I'll draw it here. anal canal. It's having internal anal sphincter, and this is if you are seeing a coronal section through the ischioanal fossa. This is a, if you are seeing in lithotomy position, anteriorly pubic symphysis, posteriorly coccyx, on either side ischial tuberosity, and this is your anal canal. Surrounding that anal canal we have one more thing, that is longitudinal muscle, that is also called longitudinal muscle, extending down conjoint tendon, and outside to that we have the external anal sphincter. So this is one thing. So what is this? These are the external anal sphincter. It's having three parts again. This will be deeper part, this is superficial part, and this is subcutaneous because it lies just underneath the skin. So this is on the midline, or you can say medial part of it. Laterally, so this is between the ischium and the anal canal. So this will be the ischium with ischial tuberosity. This point specifically is ischial tuberosity. Over this we have obturator internus muscle. So lining this obturator internus, there is a fascia called obturator fascia, and there is a muscle which is having fibers from this, few fibers from this obturator fascia going obliquely towards the anus. So that is levator ani muscle. So lining that also there is a fascia. This is the inferior fascia of the pelvic diaphragm, right? So this is levator ani with its fascia. You can say this as anal fascia also. And there is some septum from this longitudinal muscle of the anal canal going laterally towards the ischial tuberosity. So this is called perianal fascia. Above this, outside that, there will be a skin. So now this gap is our ischioanal fascia. So how is the shape of it? Shape of it something like a wedge shape. And coming to the boundaries, if you see this diagram, here you can see anterior boundary, posterior boundary. In this you can see it's something, what are the other boundaries? Apex, base, medial boundary, and the lateral boundary. So what is anterior to this ischioanal fossa here? Anteriorly it's related with the posterior posterior margin of the perineal membrane and even the pouches. And how is it related posteriorly? It's related with the sacrotuberous ligament. So this is posterior, this is anterior. Anteriorly it's related with perineal membrane and posterior margin of the pouches. Posteriorly it's related with sacrotuberous ligament and the lowermost fibers of gluteus maximus. So that is anterior and posterior. And this is the apex, this is the base, and this will be the lateral wall, and this is a medial wall, and this is a lateral wall. So one more thing you need to know is, underlying this, deeper to this, we have one more fascia called lunate fascia. I'll draw the dotted line. So this dotted line is lunate fascia. So coming back to the boundaries, so how is the apex formed? Apex is formed from where this levator ani is originating from the obturator fascia lining the obturator internus. So this point is apex. Base is formed by the skin, perianal skin, that is forming the base. Then lateral wall and medial. If you compare the lateral wall and the medial wall is horizontally, whereas the medial wall is somewhat sloping downwards and medial. So lateral wall, how it is formed? It's formed by some muscle fibers, and it's formed some part by the bone. So what are that muscle fibers? That is obturator internus, and the fascia lining that is obturator fascia. And apart from that, lowermost you can see ischial tuberosity. So these two are forming the lateral wall. Medial wall, how is the medial wall? It is sloping downwards. So how it is formed? It's formed by the levator ani muscle and the anal fascia. And additional to these things, you have one more thing, that is your, what are these three? That is external anal sphincter. So these two are forming the medial wall, levator ani with the anal fascia and external anal sphincter. Lateral wall is formed by obturator internus and ischial tuberosity and the obturator fascia. Apex is where this levator ani is originating from the obturator internus. Base is formed by the perianal space. Anteriorly, posterior margin of the perineal membrane and posterior margin of the pouches. Posteriorly, it's formed by sacrotuberous ligament and lowermost fibers of the gluteus maximus. So here, next thing is fascia related with this. Before that, along the lateral wall of this, we have a canal called pudendal canal, which is also called Alcock's canal. So this is pudendal canal. It's having pudendal nerve, internal pudendal artery, and other things. So that is our pudendal canal, which is present in the lateral wall of the Ischioanal fossa. So what are the fascia you can see? Laterally, obturator fascia, which is lining the obturator internus. Medially, we have this anal fascia lining the levator ani muscles. Inferiorly, this is the longitudinal muscle of the anal canal. From that downwards you have a conjoint tendon. From that conjoint tendon there are some septations going laterally. Out of that, one septation is going till the ischial tuberosity, that we are calling it as the perianal fascia. Then apart from that, in the inner part, we have a fascia which is something like a cone shape. This is lunate fascia. So we have total 4 fascia: obturator fascia along the lateral wall, anal fascia along the medial wall, apex and entire thing is related with the lunate fascia, and inferiorly perianal fascia. So these things, lunate fascia and perianal fascia, are dividing this ischioanal fossa into 3 parts. So this highest point of the lunate fascia, if you see something like this, if this is a lunate fascia, this point, that is this demarcated by that line marked, that you are calling it as tegmentum. Tegmentum is nothing but the highest point of the lunate fascia. So based on that, this gap above this tegmentum, that region is called as suprategmental space. This is lying above the tegmentum, that's why you are calling it as suprategmental space. And the space between the lunate fascia and the perianal fascia, this is actually ischioanal space proper. And this space below the perianal fascia, you are calling it as perianal space. So this entire thing, ischioanal fossa, is filled with mostly with pad of fat and some fibrous tissue. So what is the function of this pad of fat? It will be allowing the dilatation of the anal canal, because it's acting like a cushion and allowing for it to dilate. And apart from that, next thing is the contents. What are the contents in this ischioanal fossa? One of the major content is, what is that? Major content is fat. So basic function of fat, it's acting like a cushion for the anal canal. The next content will be from the lateral wall, one branch from one artery will be going from the lateral to the medial wall. Accompanying that, there is also a nerve going from this lateral to the medial wall. Those two are called, that will be the next content, that is inferior rectal nerve and artery. Those are the next contents. So what is the peculiarity of those contents? They are arising along the lateral wall, that is in the pudendal canal, and coming towards the medial wall to supply the external anal sphincter. So what are they? One is inferior rectal artery and one more thing is inferior rectal nerve. And apart from that, next thing, if you see in this lithotomy position, there will be some nerves coming from this back. That is our next content, that is perineal branches from S4, fourth sacral nerve. From the fourth sacral spinal nerve, there are some branches going to the perineum. Apart from that, few branches will be going anteriorly. Those are posterior scrotal arteries. So what are the contents in that? One major content is the fat, then inferior rectal nerve and artery, then perineal branches which are arising from the S4, then posterior scrotal arteries. That is the contents of it. Then apart from that, there is rhesus. This will be going, this has continuation into the anterior part, that will be going above the deep peroneal pouch. So above the deep peroneal pouch, this extends till the pubic bone. So that is the anterior recess of this. This anterior recess is going till the pubic bone, and one more thing, that is still above the deep perineal pouch, or simply deep pouch. Then apart from that, there is one more recess going backwards, that is posterior recess, that will be related on either side of the coccyx, and it will be between the sacrotuberous and the sacrospinal ligament. And apart from that, main thing is, if you go to the applied aspect, if there is an infection in this right side of the right side of the ischioanal space, that infection can spread to the other side. So that is because here you have a space behind the anal canal, that is posterior perianal space. So through this space, this right ischioanal fossa will be communicating with the left ischioanal fossa. So applied aspect, as it is having abundant fat and everything, there are chances of abscess formation, ischioanal abscess. If this abscess, if it is going to the anal canal, then if this abscess is spreading to the anal canal, and there are chances of forming fistulas. Coming back to pudendal canal, other name for pudendal canal is Alcock's canal. So pudendal canal, where did you get this pudendal canal? Pudendal canal is present along the lateral wall of the ischioanal fossa. So this will be obturator internus lining that obturator fascia. From there we had levator ani muscle lining it is anal fascia, and in between all this there is one more fascia called lunate fascia. So pudendal canal is present along the lateral wall of the ischioanal fossa. So this pudendal canal, it's having some boundaries and content. So what is forming the medial wall for that? Some books they say lunate fascia, or some books they say it's pudendal canal is formed by splitting of the obturator fascia itself. So on one side we have lunate fascia, and on the other side we have obturator fascia, which is nothing but fascia covering obturator internus muscle. So how is this pudendal canal and how is it located? If you see the ischial bone, it's having greater sciatic notch, ischial spine, and lesser sciatic notch, and this will be the ischial tuberosity. Then this will be obturator foramen. So it's starting from this lesser sciatic notch going anteriorly. It's nothing but a space between the fascia, and will be extending till the posterior margin of the deep perineal pouch. So this is our pudendal canal. How is it formed? Either it might be formed because of splitting of the obturator fascia, or you can say it's present between obturator fascia laterally and lunate fascia medially. So what are the contents in this pudendal canal? So what comes out from this greater sciatic notch goes out and comes back into the perineum via lesser sciatic notch. Do you remember pin structures? What are the pin structures? Pudendal nerve, internal pudendal artery, and nerve to obturator internal. So that P and I, they are present in this. One is the pudendal, internal pudendal artery, and one more thing will be artery along with the vein, and one more thing will be pudendal nerve. So what are those two? One content is pudendal nerve and other content is internal pudendal artery. So coming to this pudendal nerve. So how is that pudendal nerve? Pudendal nerve is coming from the sacral plexus, so it's carrying S2, S3 and S4 fibers along with that. Then how it is getting, it's coming out of the pelvis, going into the gluteal region below the piriformis, and it's turning over this dorsal part of the ischial spine and coming back into the perineum through the lesser sciatic notch. Then after it's entering into the pudendal canal. So pudendal nerve related with that. First it's arising in the pelvis, then it's going into the gluteal region via what? Greater sciatic notch, and then changing its direction over the dorsal part of the ischial spine. This is the spine of ischium. Then again coming back into the perineum via through this lesser sciatic notch and then entering into the pudendal canal. So that is a major content of the pudendal canal, that is pudendal nerve. Then what are the branches from this? One of the, if you see, this is the pudendal nerve. First nerve arising from that is inferior rectal nerve. So it's going arising along the lateral wall of the Ischioanal fossa and going towards the medial wall to supply the external anal sphincter and even the perianal skin. So that is the first branch of this pudendal nerve, that is inferior rectal nerve. The next thing is it's giving a branch called perineal nerve. This is perineal nerve. So this perineal nerve is again having two branches. One is deeper branch and one is superficial branch. So deeper branch is a muscular branch. It's supplying all the muscles which are forming the urogenital diaphragm and even this deep transverse perineum, superficial transverse perineum. So in general you can say the deep branch which is arising from the perineal nerve, it's going and supplying the muscles. Then other one is a cutaneous branch which grows to the scrotum in males and labium in females. So this is posterior scrotal nerve or posterior labial nerve. Then this perineal nerve will be continuing as dorsal nerve of penis. So that is the course of this pudendal nerve, which is a major content of the pudendal canal. So as soon as it is entering the pudendal canal, it's giving a branch called inferior rectal nerve, which is going from the lateral wall to the medial wall of the ischioanal fossa and supplying the external anal sphincter and the perianal skin region. Then it's giving a branch called perineal nerve which pierces this perineal membrane, and it's one branch is deeper branch which is a muscular branch, and one more branch is superficial branch which is a cutaneous branch. So it in males it is posterior crotal nerve, and its females it's posterior labial nerve. Then it's containing as dorsal nerve of the penis. Then the next content in this is internal pudendal artery. So where is this internal pudendal artery? It's a branch from anterior division of the internal iliac artery. So internal, next thing is, next major content in this pudendal canal is internal pudendal artery. It's a branch from internal iliac artery. Which division? Anterior division of internal iliac artery is giving this internal pudendal artery. So this internal pudendal artery is also having the same course. It's arising somewhere in the pelvic region, coming into the gluteal region through this greater sciatic notch below the piriformis, then crossing, it's crossing behind, or you can say dorsal to the ischial spine, and coming into the perineum via lesser sciatic notch and entering the pudendal canal. Same thing like the pudendal nerve. So this is pudendal canal. So this artery passes with that. Same way, as soon as it entering, it's giving a branch parallel to that. Now what is this? This will be inferior rectal artery, same course as that. Now it's arising from the lateral wall of the Ischioanal fossa and going towards the medial wall. Then we have perineal branch. Perineal branch, it gives posterior scrotal or posterior labial branch or arteries. Then it gives a branch to the bulb of penis or bulb of vestibule. Along with that, there is a branch going to the urethra. So after perineal, there is a branch, that is a branch going to the bulb of the penis or the bulb of the vestibule. Then it's dividing into two branches. One is going along the dorsal part of the penis, so dorsal artery of penis or clitoris, dorsal artery of clitoris. Then other one is deep artery of penis or deep artery of clitoris. So what are the branches? One is inferior rectal artery. Second thing is perineal artery. From that there are posterior scrotal or posterior labial arteries. Third one is branch going to the bulb of penis or bulb of the vestibule. And one more thing is supplying the urethra, so this urethral branch. Then deep artery of penis or deep artery of clitoris and dorsal artery of penis or clitoris. These branches will be somewhat parallel, or you can say accompanying the nerves, right? What is this? This is a pudendal nerve. One is this inferior rectal, perineal, dorsal nerve of penis. So that is about the pudendal canal and its contents. Pudendal canal is nothing but a space between the fascia, obturator fascia. Either the obturator fascia is splitting, or it's a space between the lunate fascia and the obturator fascia. It's extending from the lesser sciatic notch going forwards, and its anterior limit is posterior margin of the deep perineal pouch. Then what are the contents in that? In pudendal artery and vein. Then you have internal pudendal artery and vein and pudendal nerve. So where is this pudendal nerve coming from? It is coming from the sacral plexus, carrying fibers of S2, S3 and S4. S2, S3 and S4, and after it's forming in the pelvis, and it's coming out into the gluteal region below the piriformis, and it's turning around the dorsal part of the ischial spine and entering from the gluteal region. It's again entering the perineum. So pudendal nerve and pudendal artery, you see the course there. Where are they originating? They are originating in the pelvic region. Then where are they going? They are going into the gluteal region through how? Greater sciatic notch. Then from the gluteal region, they are turning the course over the dorsal part of the ischial spine, and from the gluteal region they are entering the perineum. So here there is via lesser sciatic notch. And what are the branches from that? First nerve is having inferior rectal nerve, then perineal branch. From the perineal it's having two things. One is a superficial and a deep. Deeper one is muscular, superficial is cutaneous. So that is posterior scrotal nerve or posterior labial nerve. Then it's giving dorsal nerve of the penis, whereas the artery, internal pudendal artery, is a branch of the anterior division of internal iliac artery, and it's giving branches parallel to that: inferior rectal artery, perineal artery from that posterior scrotal or posterior labial branches, then artery to the bulb of the penis, or you can say artery to the bulb of vestibuli, and one more thing, that is one branch going to the urethra, then deep artery of penis or clitoris and dorsal artery of penis or clitoris. Here you need to know one applied aspect is pudendal nerve block. So for this, they try to palpate the ischial spine, and in that region they inject the anesthetic so that the area which is distributed by this pudendal nerve is anesthetized. Thank you.